Good evening, everyone. My name is Barkha Dutt. You're with the Mojo Story. We've been on the ground traveling through Maharashtra, Gujarat, and now we are here in Delhi, which is now officially the worst hit in terms of caseload, more than 25,000 cases in the last 24 hours. Delhi has gone into a week-long lockdown. Several other states have announced restrictions as well. This, which seems to have become the new reality of my journalistic life for more than a year now, this show is coming to you this evening from a Kabristan in the heart of the capital, where behind me in the distance, ambulances are coming in ferrying bodies. Arvind Kejriwal, the Chief Minister of Delhi, says that the health system in the capital is at break point. I can testify to the fact that that description would hold true for wherever I have travelled, whether it is the city of Mumbai, the financial capital, or the Prime Minister's and the Home Minister's home state of Gujarat. In fact, some of the scenes I saw at the crematoriums in Surat are simply undescribable. And as journalists, we should never be short for words, but I have found instances in the last 10 days of being on the road where words have indeed failed me. On this special broadcast today, as we continue to report from the ground, we're looking at the Modi government's big COVID crisis, in fact, India's big COVID crisis, where the country is quite literally unraveling under the weight of the second wave of this virus. We're also going to be looking at the absence of a cohesive, consistent communication strategy and several completely insensitive and some would say tone-deaf statements that have come from ministers in the government, including Mr. Piyush Goyal and Mr. Harsh Vardhan today, who have created controversy with their comments. And as always, we'll be talking to doctors and experts on whether there is any way out of the mess that this country finds itself in at this moment. But first, it is all too easy to maybe make ourselves feel better by looking at COVID deaths in terms of numbers, in terms of data, in terms of trying to imagine that it'll happen to someone else, but it won't happen to us. Which is why we thought that as painful as it is important to personalize the tragedies behind the numbers. There are any number of in-depth reports that you can watch on our platform from Gujarat and from Maharashtra, but I'm going to play out to you a little excerpt from the story of one family and the images that I confronted at Surat Civil Hospital, which, by the way, is treating 1,400, just let that number sink in, 1,400 COVID patients. 300 of those patients are on ventilator and 600 are on oxygen. This, the story of Sangeeta and her husband, Sandip. The women cry freely, like they want the earth to open up and swallow them. The men try and put on a stoic face, but the intensity of pain and loss is visible in their eyes. At Surat Civil Hospital, 1,400 COVID patients are being treated. 300 of them are on ventilators. Here, quite literally, there is an explosion of grief. Serpentine lines of ambulances, stretchers with bodies. That's someone's husband or someone's daughter maybe. Every corner manned by a person in an otherworldly PPE kit. And the hurt is raw and visceral and has no space to hide. There is no filter here or niceties as families sit on the road under a blazing sun and wait for just one look, one brief glimpse of their loved ones. Almost everyone we meet here has the same story. Private hospitals that turned them away before they came here to the government facility. At the civil hospital in Surat, unspeakable tragedies like this one. You can see Sangeeta there in the background, whose husband, Sandip, has just died from COVID. And Sandeep's father, Banerjee, is here. This is the family that wants the rest of the country to hear their story. और हम इनसे बात करेंगे. Banerjee, संदीप जी की उम्र, आपकी बेटी की उम्र बहुत यंग थी, 35. क्या हुआ?
कुछ नहीं है, कोरोना हुआ था, कोरोना से आगे बढ़ के दूसरा कोई बीमारी नहीं था, खांसी आती थी, दूसरी और कोई बीमारी नहीं थी। वो हमको पांडेसरा ले गया, वो पांडेसरा वाला ने प्रेशर ऑक्सीजन कम बोला कि भाई तुम्हारा लड़का का ऑक्सीजन कम है, तुम सिविल में लेके जाओ। दूसरी जगह नहीं थी, रात को 2:30 बजे का टाइम था, किधर भी जाने वाला नहीं था, प्राइवेट में ले जा सकते नहीं थे। 108 वाला को बुला बेटा, 108 वाला सिविल में दाखिल कर रहा है, इसीलिए हमने बोल दिया कि भाई प्राइवेट में मना करो, कोई भी संजोग नहीं था।
मतलब जगह नहीं मिल रही थी कि क्या हुआ प्राइवेट में?
वो प्राइवेट में जगह नहीं मिलने के वहाँ से ऑक्सीजन उसको कम पड़ा, प्राइवेट में ले गया था, पर प्राइवेट में ऑक्सीजन की खामी हो गई, नहीं तो ऑक्सीजन उसको पूरा मिलता, पर उसमें 84 दिखा देता था।
फिर यहाँ आया?
फिर यहाँ आया, कोई और मुकाबला नहीं था कि हम किधर भी जावे।
और सबसे बड़ा मुश्किल क्या पड़ा? ऑक्सीजन ढूंढना, बिस्तरा ढूंढना, क्या सबसे बड़ा मुश्किल क्या पड़ा?
ऑक्सीजन की खामी थी बस, और कुछ नहीं। और
यहाँ पे क्या हुआ फिर?
यहाँ से तो एडमिट किया ने, जब से हमको बेंजी हमको अंदर तो ले जा सकते नहीं, अंदर तो मना करते हैं।
आप देख नहीं,
एक आदमी को जाने वाला है, पर एक आदमी भी अंदर वहाँ नहीं जा पाए। उसकी औरत को भी जाने देगा तो अच्छा है, पर उसको औरत को भी नहीं मना।
तो कोविड का बीमारी ही ऐसा है।
बीमारी पर थोड़ा तो समझना चाहिए ना, उन लोगों को भी थोड़ा समझना चाहिए। 108 को बुलाया तो 108 वाला भी
108 क्या है? वो हेल्पलाइन
108 है ना, हेल्पलाइन को बुलाया, उसको बोला कि भाई उसमें विनोद भाई तुम नहीं बैठ सकते, लेकिन आधी रात को एक और टाइम है, इसे में कोई रिक्शा के कोई साधन नहीं मिलेगा, हम साधन बिगड़ आया है, हम भी इधर अंदर बैठ सकते।
कितना हॉस्पिटल प्राइवेट ट्राई किया यहाँ आने से?
एक ही।
वहाँ ऑक्सीजन नहीं था?
ना ऑक्सीजन कम पड़ता।
प्राइवेट हॉस्पिटल गए, वहाँ ऑक्सीजन नहीं था?
ऑक्सीजन था पर कम
पड़ा था।
90 जगह पर 84 आता था।
अच्छा।
इसीलिए उसने माथा पे हाथ डाल दिया कि भाई तुम दूसरी जगह पे जा सकता है, उसकी बदलामी नहीं लेने के लिए इधर भेज दिया। अभी रात के टाइम पे
मतलब प्राइवेट हॉस्पिटल ने मना कर दिया लेने से?
हाँ, 84 आया ना, इसीलिए इसने मना कर दिया।
तो ये बता रहे हैं कि जब प्राइवेट हॉस्पिटल में ये गए, क्योंकि इनके बेटे का ऑक्सीजन डिप हो चुका था, प्राइवेट हॉस्पिटल ने लेने से इनकार कर दिया कि वो पॉसिबल डेथ उनकी जिम्मेवारी ना बने।
बराबर है।
क्या नाम है प्राइवेट हॉस्पिटल का?
कृष्णा हॉस्पिटल, पांडेसरा।
तो कृष्णा हॉस्पिटल ने इनकार कर दिया आपके बेटे को एडमिशन देने से।
ठीक है।
फिर आप यहाँ आए?
फिर इधर आ गए।
फिर यहाँ क्या हुआ?
इधर तो भेज दिया, उसको भगवान को मालूम कि क्या करा ना क्या नहीं करा, हमको अंदर जाने नहीं देते, कोई सूचना नहीं देते ना, कोई नहीं। बॉडी दे दी, संदीप जी को इधर छोड़ दिया ने, वो अंदर लेके चला गया। फिर तो किसी को जामे आखिर रात बाहर बैठ के निकाला। फजर में क्वारंटाइन टाइम चालू हो गया, 6 बजे तक नहीं जाने देते, मना करते हैं, इसीलिए 6 बजे तक।
तो पता नहीं क्या हुआ यहाँ कितने दिन थे?
यहाँ 4 दिन हो गया, इधर 4 दिन हो गए।
तो आप देख सकते हैं कि आप ये सूरत के अस्पताल में आए, यहाँ पर सिविल अस्पताल में, तो यहाँ पे विनोद जी हैं, विनोद जी बैठे रहिए आप। ये विनोद जी हैं, इनके बेटे थे संदीप, और ये कहते हैं ये पहले गए एक प्राइवेट अस्पताल में गए, तो प्राइवेट अस्पताल ने एडमिशन देने से इनकार कर दिया, क्योंकि उन्होंने कहा कि संदीप का ऑक्सीजन बहुत ज़्यादा लो है, और उन्होंने जिम्मेवारी लेने से इनकार कर दिया। और ये है संदीप की पत्नी, और ये संगीता जी है, ये खुद भी अर्ली 30s में है। इनके हस्बैंड जो है 35 या 34 इयर्स के थे। संगीता जी, मुझे मालूम है आप बहुत दर्द में हैं, लेकिन आपके साथ जो मुश्किल हुई आप बताना चाह रही थी कि उसके बारे में आप बात करना चाहती हैं, तो बताइए सबसे ज़्यादा मुश्किल क्या हुई?
मैं सो के ऊपर,
छोटा बच्चा है,
मेरा छोटा बच्चा है, वो
रखने वाला है, पूरी जिम्मेदारी मैं उठाता हूँ कि भाई मेरा लड़का का लड़का है, उसका अब्बा नहीं है, तो मेरे को 5 सब जिम्मेदारी मैं लेता हूँ कि भाई मैं देख रेख करूँगा, सारवार करूँगा, कुछ भी मैं करूँगा, मैं जिंदा हूँ जब तक।
आप क्या काम करते हैं? आप क्या काम?
मेरे को भी देखने का है।
आप क्या काम करते हैं विनोद जी?
हमारे एक शॉप है रैंडरमैन गांधी करियाना की, उसमें हमारा थोड़ा चला करता है। हाँ, अभी उम्र मेरी 61 है। हम भी मेरे आयुष्य भी मैं हाथ में लूँ तो कितना आयुष्य है मैं जान सकता हूँ।
पर बच्चे की उम्र क्या है?
मेरे बच्चे की 2 साल की।
2 साल की बच्ची है? बच्चा है। और जब ट्रीटमेंट कराने का कोशिश कर रहे थे तो सबसे ज़्यादा मुश्किल दवाई का पड़ा, हॉस्पिटल ढूंढने का पड़ा, क्या पड़ा विनोद जी?
कुछ नहीं, हॉस्पिटल तो इधर बहुत गया,
ऑक्सीजन ही नहीं मिला।
कौन सा हॉस्पिटल? प्राइवेट वाले में?
प्राइवेट वाले में।
ऑक्सीजन नहीं मिला? क्या बोले आपको?
मुझे तो पता ही नहीं, मेरा ससुर थे उसके साथ 2 बजे रात को 2 बजे वो लोग 108 में फ़ोन करके इधर लिए आए, प्राइवेट हॉस्पिटल से इधर ले आए।
प्राइवेट हॉस्पिटल ने कहा ऑक्सीजन नहीं है।
वो पांडेसरा में है।
कृष्णा हॉस्पिटल में था ना, इन लोगों ने बोला कि तुम इधर से ले जाओ सिविल में केस लेगा, दूसरी जगह केस नहीं लेगा। 108 आएगी तो 108 तुम्हारे को
जो एम्बुलेंस लाइन
एम्बुलेंस वाला 108 वाला एम्बुलेंस वाला है ना, उसने 108 में इधर ही भेज दिया कि दूसरी जगह पर मना कर देगा, इसीलिए तुम वहाँ ही ले जाओ, नहीं वहाँ ही ठहरेगा। नहीं 108 में क्या ऑक्सीजन है, तुरंत संदीप जी को ऑक्सीजन तुरंत ही मिल जाएगा।
तो ये
ऑक्सीजन में मिलने के उसका ऑक्सीजन परफेक्ट हो गया। 91 से 91 101 तक भी ऑक्सीजन उनको आ गया था। जब तक वो पांडेसरा में है ना, ऑक्सीजन की कहीं गलती होगी तो वहाँ 84 बता रहा। इतनी जल्दी तक तो 5 मिनट में तो इतना ऑक्सीजन ऊपर नहीं हो सकता।
तो आपको लगता है वहाँ ही गड़बड़ हुआ?
हाँ, 84 ऑक्सीजन था तो 84 का 101 कहाँ से आ जाता? अपन को भी दिमाग में आता है कि इधर हॉस्पिटल छोड़ी, इधर 108 एम्बुलेंस है, 108 की जगह भी 101 हो गया तो ऑक्सीजन में डिफिकल्टी।
हम आपका दर्द समझ सकते हैं। ये विनोद जी हैं, ये संगीता जी हैं, ये इनका परिवार है, आप यहाँ देख सकते हैं। हम सूरत के इस समय सिविल अस्पताल में हैं और ये एक परिवार का दर्द है, लेकिन ये जो दर्द दिखा रहे हैं, ये जो दर्द बता रहे हैं, ये बहुत सारे परिवारों का दर्द है। आप यहाँ आइए, अस्पतालों में देखिए, और सबसे कॉमन जो आपको फीडबैक मिलता है वो यही है कि ऑक्सीजन कम पड़ रहा है और प्राइवेट हॉस्पिटल ने एडमिशन देने से इनकार कर दिया। और आप देखिए तो स्टेटिस्टिक्स तो एक चीज़ है, लेकिन संगीता, उनके 2 साल का बच्चा और संदीप के फादर विनोद जी, उनका दर्द कैसा जाएगा? उनका दर्द कैसे जाएगा? As we wait with the families, the toughest thing for them is that COVID took away their right to even say goodbye in the final hours. And there's many stories like that of Sangeeta and Sandeep, more than I could count, more than I could even bear to actually report. And then when I contrast that entire cry, incoherent at times, you can understand how much pain that family is in over oxygen. The pictures of politicians and posing with, but these are the pictures that actually came out of Madhya Pradesh. The oxygen tankers were actually held up because there were netas who decided to pose for photos with them. Those are the tankers, but I think at some point can we yeah, you can see that there were people who lined up and actually held that delay up till the perfect photo op was done with balloons. I mean, it is actually surreal. Dystopian doesn't even begin to describe it because these netas then insisted that they must be first photographed with these oxygen tankers. All right, we're looking at this sort of unraveling crisis and the government's failure quite clearly to communicate either clearly or with sensitivity on this crisis as it mounts and grows. Let me introduce our panel with us. We are broadcasting today from the worst hit city of Delhi, which has seen more than 25,000 cases in the last 24 hours. I am presently at a graveyard where the bodies are being brought in, and I'll introduce everybody one by one. We have Dr. Arvinder Soin, well-known doctor, who's actually ended up testing twice for COVID. This is an outlier thing, and he's feeling quite fine, thankfully, and we'll talk to him a little bit to understand what happened to him. Sandip Ghose, commentator who wrote a piece just today on the absence of clear communication from the government on this crisis. Shantanu Gupta, author, biographer of a book on Yogi Adityanath, is with us. Dr. Swapneil Parikh, he and I have been arguing for a long time about lockdowns. Lockdowns are upon us again. I'll raise the question as to whether that's the solution at all. Tavleen Singh, well-known columnist, veteran journalist. Radhika Ramaseshan, well-known columnist and journalist. Both of them very senior voices from my fraternity are with us. And what I want to do is actually start with Tavleen and Radhika. And Tavleen, I'll start with you. I just felt it important to start with the story of one family, and there were many others of the kind that I met there. And this one hospital with 1,400 patients, the doctors going absolutely crazy, the cremation grounds were being worked 24/7 so that even the furnaces made from iron have melted. And yet we see completely confused, I would say, messaging from the government. What what do we make of what's happening and where we are?
I'm beginning to get the feeling that the ministers and the Modi government haven't understood the enormity of the crisis that this government faces. It's probably the biggest crisis they've been in. And instead of actually trying to deal with it, all we're getting from them is comments like, try and restrict oxygen. Piyush Goyal, I tweeted about it. I was horrified that he could say that oxygen, for a start, it's the government's fault that oxygen is not available. Then he says states must stop wasting it and you must restrict the use of it. What does that even mean? Then, at a time when the country needs to come together, we have the health minister insult a former prime minister because he's trying to help and laying out a few steps. He could have politely said, we've already dealt with these, sir, but we'll come to you if we need more help. Instead of that, the health minister's letter is a kind of insult, saying, you don't know what you're talking about. Now, what does this government believe should happen? You've got the prime minister campaigning somewhere, and you've got his not junior ministers, they're senior ministers, insulting the opposition leaders with whom they should be consulting. They should come together. They should have a meeting every day to deal with really the worst crisis that I have seen in my journalistic career, which has been a very long one. I've never seen a situation like this in India before. And, you need all hands on deck. You need all the help you can get. And I'm very, very saddened and actually very depressed to have seen the reaction that we've seen so far from this government.
And do you think it's denial, or do you think it's just their way that they don't like seeking help? And if they're criticized, and Harsh Vardhan clearly thought Manmohan Singh's comments were a criticism.
They were actually very polite comments, polite suggestions on what can be done next. I don't think that they have understood what they should be doing next, which is why they've become so sensitive. You see, at one point, not so very long ago, they thought they had everything under control and that India was becoming the pharmacy of the world and we were doing better than everybody else. And now that this has hit them, it's as if they've suddenly been hit by a tsunami and they're just completely without an oar they're in a boat without an oar. And it's very scary because those are the people at the moment who we have to rely on to try and solve this enormous crisis.
Radhika, I'll let you add to that. And then, of course, I'll play out Mr. Goyal's remarks for anyone who had missed them. And, I have been going on about oxygen from 2020 till now. And I think people didn't understand it till they actually saw, young people in their 30s and 40s just dying because they couldn't get high flow oxygen. And then, you saw the kind of statement that came from Mr. Goyal today saying that the demand side has to be managed. Ki jo log maang rahe hain, wo apne aap ko thoda manage kare.
Yeah, Barkha, I would say that there is neither confusion nor is there mixed messaging. There has been a sense of triumphalism as far as this government is concerned from the beginning. Oh, we are on top of the situation. So, it's triumphalism, it's gimmickry, it's exaggerated claims. I mean, it's almost like there's a put-on exterior of success, which is just coming apart. Actually, when did we get on top of the situation? We've all been going through it for more than a year. And I don't recall a single moment where I felt that, okay, I'm comfortable. Maybe I can discard one mask and just wear a second one and go out. No, I never felt reassured. I never felt comforted at any point. So, I mean, to think that, we've defeated Corona, the virus, so many times, it's an empty claim, based on what? It is based on medical illiteracy. For God's sake, please start consulting a wider community than just the bhakts and the trolls and whoever you are in touch with every day. This kind of a thing needs a much wider consensus. Of course, Tavleen is right. You do need to talk to the opposition, to the other political parties, to your own allies. I mean, things have reached such a pass that in Uttar Pradesh, the government, that is Yogi Adityanath, woke up only when his law minister, Rajesh Pathak, wrote a scathing letter to the health officials, talking about the gravity of the situation, about the bodies, about the lack of space in the crematoriums, the lack of wood. I mean, people having to do with damp wood, no ghee, no nothing. I mean, this is the state of affairs. There was an MP from Mohanlalganj near Lucknow who pleaded with Yogi to please put off the panchayat polls, which are underway. Today, you had the second phase of the panchayat polls. He said human lives are more important than elections. But who is prepared to listen? So that brings me to the other point that apart from triumphalism, it has just been about politicking, politicking, politicking. All that you have got from this government is politics and more politics, as though, West Bengal is the last election to be fought and won. Assam has to be retained, the UP Panchayat elections have to be won, the Kumbh Mela has to be held because Uttarakhand and UP are both going to polls early next year. So we cannot afford offend the sadhus and the mahants. I mean, what on earth is happening? You cannot give precedence to electoral politics in this manner and then go around making all kinds of claims. Anyway, there's complete radio silence from the top of the kind that you saw after the India-Pakistan face-off before the last Lok Sabha elections. There was a phase when nobody from the government was ready to talk. And this phase reminds me of that. Where is the address to the nation? Where is the Man Ki Baat? Let somebody say something. Okay, the Home Minister has started giving a spate of interviews, but I do not think any of his contentions, any of his arguments on why they are campaigning so hectically in Bengal makes sense to me. I mean, it's cruel what they've inflicted on the people of this country.
And I can tell you that actually this is not one state versus the other, Radhika. From traveling extensively everywhere at cremation grounds or the graveyard where I'm sitting right now, space is running out. And I will never forget the words of a man I met at a cremation ground in Mumbai, actually, who said to me, "Pehle अस्पताल में जगह नहीं थी, अब शमशान घाट में जगह नहीं है." And he was angry and he was crying and he had rage and he had tears and he had all of it together. And Sandeep, you have been writing about the silence of the Prime Minister, who you otherwise think is an effective communicator. But before you comment on that, I just want to play out, if we can, Mr. Goyal's extraordinary remark on oxygen.
जहां पे पेशेंट को जरूरत है उतना ही ऑक्सीजन लगाना चाहिए. कई जगह पे वेस्टेज की भी खबर आ रही है. कई जगह पेशेंट को ना जरूरत होते हुए भी ऑक्सीजन लगाने की खबर आ रही है.
Okay, so he went on to actually say in that comment that the demand side had to be managed better, right? And I know that the doctors will have a lot to say about that, because every time the doctors are told rationalize the use of oxygen, I know doctors get very angry. But Sandeep, on the communication dimension, go ahead. Can we unmute Sandeep, please?
Yeah, Barkha, Goyal or Harsh Vardhan, I would like to put them aside right now. Those are bad form or those are ignorant statements. What Harsh Vardhan has told about to Dr. Manmohan Singh, he can probably later on go and patch up by apologizing. But the bigger issue is what's the message coming out to the whole world or to the nation essentially. And that is where my worry is. What's happening between, scoring points between politicians, Rahul Gandhi making a statement or somebody else making a statement. I think to my mind, those are somewhat secondary given the gravity of the situation. Today, we are in emergency in every sense of the word, whether it's a humanitarian, whether it's a public health, and it could be one of national security, and even somewhere along the line, it could become a political emergency. So in this situation, what is very, very surprising is, one is lack of communication, and then secondly is this whole miscommunication which is happening. People have got no business to speak or who have got no idea about this stuff. What does Piyush Goyal know? With due respects, he is a finance minister. He's a chartered accountant like me. I would not claim to give an opinion, about medical issues. So these are totally avoidable, and the person who can speak and who has the credibility to speak in the country, I don't know why Mr. Modi is staying silent. I would, while these things are bad optics of going and electioneering, etc., but that is to some extent, I think, it's not really a material issue. I think Tavleen or Radhika were mentioning about meetings. Meetings are happening, we know. Mr. Modi works 24 hours. When he comes back, he's holding meetings and all that. But what is the outcome of the meetings? What is the strategy? That the nation has to be communicated. Otherwise, you are going to have this kind of chaos, not only among the people who are suffering, but other people who are responsible. So whether it's the doctor community, the health care professionals, or the hospitals, everybody needs to understand what is our national, which direction we are moving.
What is the message you think they've sent so far, Sandeep?
They have not sent any message at all, Barkha. That's the sad part of it. And whatever message has gone, it has been totally garbled. And apart from being garbled, it has been sometimes at cross purposes. I don't think it has served any purpose at all, including, the defensive messages about why rallies are happening or why Kumbh was happening, or somebody else like me saying that, okay, you're talking only about Kumbh, why aren't you talking about the Thrissur festival, or, still the farmers' protest is going on. These are all scoring points. I don't think those really matter. It's good for our chats and TV shows, but it's a very big, it's a national calamity, or as you say, a couple, it's of that nature. So in this situation, someone like Mr. Modi, who is always seen, like last year, exactly this time, what was he doing? He was addressing the nation every week, practically. He was calling up, as I've written in my article, he was calling up healthcare workers, people, and so there was a total outreach. Now, why suddenly all that has disappeared? The only charitable explanation I can give is the government is also clueless. They're trying to get their act together, and they would like to come out and talk in a comprehensive, consolidated manner. But till then, you just can't have, motor mouths or people just shooting in any direction and muddying the waters even more.
Okay, I want to get to the doctors, but a quick response from Tavleen, then Shantanu, on the Prime Minister's silence. Is that what's needed, the Prime Minister to address the nation? The last time the Prime Minister was speaking in a way that was accessible to the whole country is when he had the meeting with the chief ministers, and he was basically going into the details of how a swab test should be done properly, and we had almost memes on how, Uddhav Thackeray was looking at his phone, Arvind Kejriwal was burst into giggles, they were called the backbenchers. I mean, there were jokes about it because he was literally finger wagging like a stern principal at errant students when he was talking to the chief ministers, Tavleen.
Okay, I also believe that Modi is a great communicator, but he seems to have got entangled in micro details, like how much oxygen and how much this, that, and the other. What about the big picture? As I said, I've actually been a journalist twice as long as as almost anyone else here, and I cannot believe that in a situation like this, where the leader has to lead from the front, we're in a situation of war. This is an internal war. General Malik said the other day that we've lost more people than we did in the Kargil war, and I think another war put together. And Prime Minister has to be here, not addressing election rallies. He's got to actually reassure the people, because there's panic, anxiety, and desperation spreading.
Yeah. And actually what's happening is there's such an absence of communication that even things that are not needed, for example, crazy lines for Remdesivir, which are actually mass gatherings in themselves, and I'll play out that report in a moment, even that's happening because there's no Dr. Fauci. Where is our Anthony Fauci, who will come every day, talk to people, tell them what to do? More than an address to the nation, Sandeep, We need an Anthony Fauci who will come and tell us every day, do this, don't do this. Science tells us it's okay to do this. For example, we now know that fomites is not how the virus is spreading, right? And the doctors can speak more to this. So that's why fewer people now wear gloves. I've been into multiple ICUs over the last 10 days, and gloves is not where the emphasis is, but we have no one telling us any of this. Shantanu, I'm going to come to the medical dimension of this conversation in just a moment with the doctors. But if you want to come in, I mean, this party, more than Manmohan Singh used to be the silent prime minister. This silence is not what was expected of this government. What was the need for Piyush Goyal to tell the doctors how to rationalize the use of oxygen? What does he know about it?
Before Shantanu comes in, Barkha, one point sideways. You're talking about Anthony Fauci. Last year, we had our own Anthony Fauci. I forget the name of this Maharashtrian gentleman who was the head of
Love
ICM.
Kumar.
Love Kumar, and who retired.
Dr. Balram.
Balram. Okay, he was doing in our own homegrown way a Dr. Fauci, and that was so reassuring. But today, none of that is happening. Why?
Okay, let me take this to Shantanu, and Shantanu, go ahead.
Yeah.
Shantanu.
I think my request with folded hand to all the panelists on this broadcast, to any other broadcast, just in this tough time, just to win your arguments, you may love one party, you may hate one party, just stop doing fear mongering. So I remember Barkha Dutt. Barkha, you around the same time a year back, you did an interview with Ramanna Lakshmi Narayanan, and he told a figure of that India will get a caseload around 30 to 50 crores and we will have around 20 lakhs death. We are nowhere close. Please allow me to complete.
Yeah, I'm just telling you what he said. I think if I remember correctly, he said 300 million cases and 2 million deaths is what he was saying.
I've noted from your tweet also. I've got your tweet. I'll quote you after.
I'm sure you remember more than I do, but go ahead. Yeah.
So 30 to 50 crore caseload and 20 lakhs death. We are standing at 3 to 4% of that. Even that is unfortunate. Well, let's give credit to all the governments. What they have done with whatever infrastructure we have inherited over the last 70 years. People say, oh, we cannot create ventilators. IIT Kanpur have created amazing ventilators. We cannot create masks. We are doing a PPE vaccine. We are one of the only developing nation which have 2 indigenous vaccinations. So let's not just create. Yeah, this second wave has surprised everyone. A lot of the so-called people who are predicting, they also not predicted something of this sort. So now governments, all governments, state governments, central governments are catching up. And if a prime minister is not communicating for 2.5 days, okay, oh, why is not communicating? Why is not communicating earlier? Why is communicating every day? So if we have a problem with prime minister, we'll have a problem with every day, right? I think that will not sort. I think you showing a grieving family in the start of the show, what will that solve? What will it solve? What purpose that will solve? Otherwise, tell them if 2.5 cases are coming every day, 1.5 lakh people are getting discharged.
I should not show the loss of people.
You can show loss of people.
We should have Excel sheets.
Do you think that will get confidence in people? No, you ask my question. I asked the question first.
I'm answering it. I'm answering it. You're asking me a question. I'm answering it. I'm not asking you a question back. I feel it's very important to actually remind everybody that there are people behind numbers. I also went to Mumbai and I met the family of a tailor, 52-year-old tailor Ram Babu, who was one of 8 people who died in a small hospital in Vasai because the oxygen ran out. I could have just said, let me just speak. I could have just said 8 people died. Would that have made you feel the same way? Or if I tell you that there was a man called Ram Babu, he worked hard to be a darzi so that he could educate his daughter. That there is Sangeeta who's 34 years old and her husband Sandip is 35 years old. People have a right to have their stories told. People are not just numbers. People are not just statistics. People are not just numbers.
Yeah, people are not just numbers. In all the 1.8 lakhs death in India and all the lakhs of deaths across the world, there is a story for sure. But I'll request you in the same breath, just do an extra mile. 1.3 crore people also got discharged from the hospital.
I do
just
those too. I do those too.
Just walk into one's house. You did not show. In the start of the show, you did not show any such case.
Watch more of what I do.
Instill confidence in people. Your Modi hate can wait for some time.
This is nothing to do with that, Shantanu.
All your Tavleens of Maharashtra, Uttarakhand, as if there is no other state. All two Maharashtra and Kerala, they don't even exist for you. all the cases of Maharashtra are happening because
I
of
just
whom?
spent a
All
week in Maharashtra. I
you did
just
not
spent
show in
a
the start.
week in Maharashtra.
Don't shout. Don't
Please,
show these extra
no,
emotions. Don't show these artificial extra emotions. Let me complete.
Arey yaar,
So on the top of it is Maharashtra and Kerala.
if
And
I
all
take
the
down my
cases in
mask,
Maharashtra, all the cases in Maharashtra are happening because of Kumbh. All the cases in Kerala are happening because of Kumbh. So come on. At least
can I say
I know
something?
you guys are biased.
Can I say something?
I know you guys are biased, but at least try to get a
Unbelievable.
Sandeep, I'll
Try
come
to
in
act
here
at least.
because Barkha has got emotional. I'm not biased, Sandeep. If anybody knows my timeline, etc., I've been an ardent. I've got no qualms in admitting I've been an ardent supporter of Mr. Modi for the last 7 years. Unlike a Tavleen who's got disillusioned, I continue to support him. Even now, okay. So
Okay, don't get personal with me, because actually the Congress Party hates me as much as he does.
That's
So I'm a
on a
journalist.
lighter vein. Tavleen, I
All right?
apologize. That was on a lighter vein.
I don't
Everybody breathe. Everybody
No,
breathe.
Tavleen, that was not getting personal. I was just saying that I
Sandeep,
continue.
I'll object to it.
Come on,
I'm
let's go.
sorry. The Congress Party thinks I hate the Congress Party, and the BJP
No, I
thinks
am
I
not.
hate
So
the BJP.
this
I
is
don't
a
like Yogi
professional
Adityanath.
hazard.
That's true.
Yeah.
Okay,
But
can we come back to the issue?
remain fair
That is
about
a professional hazard.
I request you
Anybody,
all to
as
come
we're
back to
all
the
like,
issues.
Barkha talks
Sandeep.
about today in favor of Modi. She's accused one way by the left wing. In fact, I'm coming to that point. Today, the problem also has happened, Sandeep. Today, statesmanship has
Not
gone missing.
Sandeep, Shantanu,
Oh,
not
Shantanu.
Sandeep.
The statesmanship has gone missing, whether in the opposition or whether on this side. What Radhika was saying earlier, I would hold both sides responsible. It's instead of throwing bricks at each other, people
I think
need to
Radhika is
talk
trying
to.
to say something.
Sorry. Uddhav is seen quite frequently on TV. I mean,
No,
I
I'm not
don't
talking
know
about. I'm
if
not
his
talking
messages
about
have substance, but he has been coming
Okay,
out.
can I
and
come
he's
in here?
quite
I'm not talking about that.
Can I just
Radhika, I'm
can
not
I have
talking
a
about
supporting their
Uddhav.
I
Uddhavs
mean,
and
you
their
accuse me of bias,
wait a minute.
but
I want to
people have already
respond.
started supporting their Uddhavs and
quite
Kejriwals.
candid
May I,
about
what I'm
it.
going to do is I'm going to ask everybody to be silent for a second because I want to say something to Shantanu. When Shantanu says to me, what about Maharashtra? I reacted the way I did because the first 7 days of my reporting was in Maharashtra. And at that time, supporters of the Sena government tweeted me and said, you're soft on Modi and that's why you're in Mumbai. When I went to Surat and Gujarat, they told me, you hate Modi, that's why you're in Surat. This is the life of a journalist. We get galis from all sides. ये हमारा काम है, हमें कोई फर्क नहीं पड़ता. We are happy to get
You are the
galis from
most
all
brutal
sides.
journalist in
I
the
am
world.
very
Wow.
happy to get...
Prize
No,
from
Shantanu,
you. I'll give a medal to you right now.
No, I'm sorry. When you say, why didn't you report Maharashtra? You are incorrect on
I
fact.
did not say. I was telling the other
Okay.
panelists
Can
who
we move on?
Who never
Can we
even
move
mentioned
on?
Kerala, who never even mentioned Rajasthan, who never even Maharashtra. I'm saying, oh, we are not politicking.
Okay.
I'm saying,
Okay,
try to at
Shantanu,
least
here's my
look
question.
neutral.
Here's my question.
There's only
Chale,
one
here's my
person
question.
politicking, it's you.
Okay, can we come back to what
Don't
we've
show
been
this
dealing with the
extra
crisis
artificial
here?
anger to me. Come on.
Shantanu, my question to you is this. Do you think Mr. Goyal should have made the comment he did on oxygen? Just simple question.
He made a very simple statement. In many private hospitals, I have seen with my own father when he's admitted, he's dead now. Private hospitals do this extra care and extra medication which is not even required. He said, "जहाँ पे जरूरत नहीं वहाँ पे मत use करो." What is wrong in that? He's not saying demand कम कर दो, जिनको oxygen है उनको मत दो. He did not say that. If you want to threadbare and wanted to word words in his mouth, that's your prerogative, right? He just said जहाँ पे जरूरत नहीं वहाँ पे मत use करो. He also said in the same session कि Indian Rail Oxygen Express provide करेगी.
Sorry, we can't hear you. We can't hear you. Can you hear me?
He also said कि Indian Railway Oxygen Express चलाएगी और it will send to every place. You don't want to show that bite. That itself shows you're biased. He just said जहाँ पे ऑक्सीजन की जरूरत नहीं है वहाँ मत दो. एक्स्ट्रा ऑक्सीजन मत दो. कहीं पे ऐसे ही डॉक्टर्स दे रहे मत दो उसको. He just said just be careful about that. What's wrong in that?
But Shantanu, today we have gone beyond those points. There was the same thing being talked about in vaccination 1 week or 2 weeks ago. There is wastage of vaccination. Today we all admit that there is actually a shortage of vaccines. We did a program, a show on this channel 2 days ago when the person who's organizing oxygen, he said, what is the problem? Even if you want to transport oxygen from the surplus areas, you can't get it across to other places because of logistics issues.
Yeah,
tomorrow, if you want to say transport from a surplus state like Jharkhand to the west, you don't have the infection spreads to Jharkhand. What happens there? So it's very, very complex issue, no doubt about it. The point I'm making is both opposition and Radhika, this is not about Uddhav Thackeray or anybody. I think this is the kind of maturity which people need to show. Whether it's Manmohan Singh's letter was very statesmanlike, but that's the kind of conversation people
on the
need
Manmohan Singh letter.
No, I'm saying people have to have a conversation of that order. You can disagree, agree to disagree, but that is where you need to have a conversation. Rahul Gandhi is not doing that. And on the government side today, unfortunately, we don't have an Arun Jaitley kind of person who can have that conversation. So that's why when Harsh Vardhan shoots or his side, some aid of his, that tweet of his is even worse than the letter, I would say. And that may have been done by somebody who is managing his handle. But this is the time, but otherwise we are all getting deflected into these minor issues. And as Tavleen said, we're missing the woods for the tree.
See, Barkha, just one last point of the Manmohan Singh letter. Any ex-prime minister who have access to all the bureaucrats possible, who have access to the prime minister office, he's writing a public letter. If it's not politics, what is? You guys are senior journalists. If you can't sniff a blatant politics in that answer, I can only laugh at it.
There is politics,
letter just for politics. That's all. So
it is politics, but politics with decorum, I would say. I think there's still a politics with decorum. I wouldn't consider the response of Dr. Harsh Vardhan in the same level. People will score points, but Dr. Manmohan Singh tried to. I have a point of view about his talking about foreign vaccines. People can have. I don't agree with it. I don't agree with that.
Getting approved, money to the Indian vaccine makers already being given. He's writing the statement which is already done, as if he will claim the credit. I said so. I
agree with you.
If you can't sniff it, that's your problem.
So as I'm telling you, I have a point of view that I disagree with that foreign vaccine theory. If you ask me, though not an expert, I'll say we have to back Covaxin. But that's a different issue.
Can I just jump? Thank you, Sandip. Can I just jump back into my own show? Let me just bring in the doctors now. And one of the things that I want to say, we've seen the political differences, but we're also seeing an absence of clear communication on simple things like, should you be queuing up for Remdesivir? I saw the most extraordinary thing at the Surat Civil Hospital. I saw a long line of people and they all said, we've come to buy Remdesivir. And as I started talking to them, I thought they were patients or relatives of families. It turned out that they were doctors and health workers themselves. So take a look at what's actually happening. Private hospitals, people are going from private hospitals to stand in line for Remdesivir. If we can just play out that excerpt, please now. No, those are the lines of Remdesivir. Can we please play out my interview? कब से खड़े हैं लाइन में? We have my interview. We can please सुबह 7:30 बजे से. किसके लिए खड़े हैं?
रेमडेसिविर इंजेक्शन के लिए.
और अपने लिए या किसी और के लिए?
हॉस्पिटल का स्टाफ हूँ मैं, हॉस्पिटल के पेशेंट के लिए.
आप हॉस्पिटल के स्टाफ है और आप यहाँ हॉस्पिटल में ही खड़े आने हैं?
हाँ, हॉस्पिटल के इंजेक्शन.
आप इस हॉस्पिटल में काम करते हैं?
नहीं, हम प्राइवेट हॉस्पिटल से लेने के लिए आए हैं.
So this is a very ironic moment. This gentleman is a frontline worker. He works in another hospital और ये अपने patients के लिए आप लेने आए हैं.
हाँ.
तो आप प्राइवेट हॉस्पिटल में काम करते हैं और आप सरकारी अस्पताल में अपने पेशेंट्स के लिए लेने आए हैं. बहुत मुश्किल हो रहा है मिलना.
बहुत 6 घंटे खड़े रहने के बावजूद इंजेक्शन नहीं मिलते, ना बोल देते हैं, फिर दूसरे दिन बुलाते हैं, फिर वापिस आ जाए. कल भी नहीं मिला था, आज भी वेटिंग में खड़ा हूँ मैं.
तो आपके अस्पताल में बिल्कुल स्टॉक नहीं है?
नहीं है,
खत्म है. आप प्राइवेट हॉस्पिटल में. हाँ. तो ये हेल्थ वर्कर हैं खुद ही और ये कहते हैं कि आपने पेशेंट्स के लिए, अब आप देखिए कि हेल्थ वर्कर्स को क्या क्या करना पड़ा. आपका नाम सर?
कौशल श्रीमाली.
कौशल भाई, अपना ख्याल रखिएगा. ये कौशल जी हैं. इनकी आप प्लीज़ अच्छी तरह से पिक्चर दिखाइए क्योंकि हमारे हेल्थ वर्कर्स को क्या क्या नहीं करना पड़ रहा है. खुद आके दूसरे अस्पताल में यहाँ लाइन में खड़े हैं, आप देख सकते हैं. पूरी लंबी लाइन है यहाँ पे रेमडेसिविर की और इसमें हेल्थ वर्कर्स खुद भी खड़े हैं. और यहाँ पर हमें बात करते करते एक डॉक्टर भी मिले. सर आपका नाम?
मेरा नाम डॉक्टर फैजान काजी है.
अच्छा, तो हमें पीछे लाइन में भी एक हेल्थ वर्कर मिले, वो किसी और हॉस्पिटल में काम करते हैं और वो अपने पेशेंट्स के लिए रेमडेसिविर लेने आए हैं. आप किसके लिए लेने आए हैं?
मैं खुद अपने पेशेंट्स के लिए लेने आया हूँ.
यू ऑल्सो वर्क इन अनदर हॉस्पिटल?
या, आई वर्क इन अ स्मॉल हॉस्पिटल and I am a medical administrator there.
And how long have you been standing in line?
I am standing since 8 o'clock here.
And are you hopeful that you'll be able to get it?
I am hopeful because they just write down my hospital's requirement for injections. It's 44 and I'm not sure totally, I'm not completely sure it's 50-50 right now. So I will not say that I will.
और आप रोज ऐसे कोशिश करना पड़ता है?
Yeah, exactly. It's my third day, and I'm
third
not
day you've
getting
been
it.
coming?
Yeah.
So 3 days you come, you stand here for how many hours?
I'm standing since 4 hours.
Third day.
Yeah, third day.
Doctor himself at the front line having to come 3 days in a row to try and get Remdesivir. और आप हर जगह देख सकते हैं कि ऐसी लाइन लगी हुई है. सर, आपका नाम?
भूपेन.
क्या लेने आए हैं?
रेमडेसिविर हॉस्पिटल से.
और आप भी किसी हॉस्पिटल में काम करते हैं? जी. कहाँ पे?
सेल्बी हॉस्पिटल से.
और आपके हॉस्पिटल में भी बिल्कुल रेमडेसिविर नहीं है?
नहीं है.
और कितने दिन आ चुके हैं आप यहाँ पे?
मैं 3 दिन से आ रहा हूँ.
3 दिन से. तो ये भी 3 दिन से आ रहे हैं, ये भी 3 दिन से आ रहे हैं. A lot of people we meeting here are actually doctors or health workers who are coming to try and get Remdesivir for their patients.
We have our two doctors who haven't had a chance to speak. So shall we start with Dr. Soin, please? Your view on what needs to be done at this juncture from a medical standpoint.
Yeah, less and less people are looking for medical advice nowadays. But anyway, so let me put the medical scene straight here. First of all, let's talk about Remdesivir. Remdesivir itself is not a life-saving drug. You don't actually give Remdesivir to people who are at home. You only give it to people who are in hospital, and that too in the first week to 10 days. And it's been shown to reduce the recovery time, but not actually save lives. So it's not a deal breaker. It's not like somebody's going to die if you don't get Remdesivir, and that's what scientific evidence shows. Now, obviously, because when people are desperate, dying in the hospital, they would just want anything, and this is one of those things. So I think that the shortage is created by the mad scramble for it, which is not really justified scientifically. I don't think everybody needs it. So this is the demand side of the drug that we've been referring to earlier in connection with oxygen that can actually be reduced. That's one. Of course, getting the stocks in order, having central control rooms so that all the Remdesivir is not just available in, let's say, a government hospital or defined hospitals. That has to be done. I believe Delhi is making a central control room for all the essential drugs, and that should be made everywhere in the country. That's a very good idea. That's Remdesivir. Then the life-saving drugs are actually steroids, anticoagulation, and oxygen, of course. Now, oxygen is in short supply. There is no two ways about it. And if you want to have a central control room of oxygen supply, that is also going to be a logical thing to do. You can't suddenly have oxygen manufacturing plants ramping up to produce double. That's not going to happen. So you can't cut down the demand side of oxygen. I agree with some of the comments made here that most people will only get oxygen when they need it, which is when they are saturating at between 90 and 94, depending on what the normal saturation was. And it's only at that point oxygen is needed. Now, tocilizumab is the other drug. And, I headed the national trial, which showed that tocilizumab helped save severe COVID patients. But the indication for that is also limited. It's in certain patients with severe disease who don't have any signs of superadded infection or are not at risk of getting superadded infection. It's only those 30 or 40% of the patients with severe disease who should be given tocilizumab. So again, indiscriminately using it is making it run into short supply. Finally, plasma therapy. Plasma therapy is, again, very questionable benefit. Very, very questionable benefit. The two studies, one from the ICMR, the first study, and the other study was in the NEJM, and both studies showed that plasma therapy actually did not help. It only helps a small group of patients, maybe 5 to 10% of the severe group of patients who are in the first 3 to 4 days of symptoms and who can get plasma with very high antibodies. So I don't think anybody should be running around madly for plasma therapy.
But Doctor, let me ask you one question.
Those are the comments I would make on treatment.
I'll just step in to ask you a question, Doctor.
Yeah, sure.
I've been on these programs for the last few days. One has not seen any kind of broad guidelines coming from the central source. Maybe but that's why you're having so many comments on all these issues. If exactly what you are saying, if that's the consensus opinion, if that gets communicated, but is that happening? On the oxygen point, I'll give you a counterpoint. What was somebody mentioned in the program a couple of days ago, that if you see the per capita usage of oxygen in Bombay, in Maharashtra and Gujarat, there is a wide difference. And from a common sense point of view, a layman's point of view, this is, I forget the numbers, somewhere it's 800 and somewhere it's 1200. So almost 50% more the per capita usage. So that's a common sense reaction. But again, are there general guidelines going out which would help people?
Of course.
And this queue business, to lighten the mood, Shantanu, Barkha should have also shown the queues today at Loknayak Bhavan and Khan Market for the booze shops. We are in the habit of, running for any kind of shortage. Anticipate we queue up there. Yes, doctor, sorry.
So what you're saying is that the per capita use of oxygen, in my view, it's a very, very, inaccurate statistic to go by. You can't just say that, you use 3.2 liters in Maharashtra and 2.2 liters in Gujarat. I don't know where you get that statistic from. I'm not buying that. I think that every doctor worth their salt will know when to use oxygen. And by and large, except for small cylinders and oxygenators that people have at home, oxygen use and abuse, if at all it happens, will be in hospitals. But I don't think anybody is abusing oxygen or using it when it's not necessary. I think all doctors will know when to use it roughly. The other thing I just wanted to say a word about vaccines. Barkha asked me in the beginning, and it's part of the reason that she wanted me on the show this evening, is that I've had an infection of COVID last year. I've had 2 vaccine doses of Covishield, the last one having been taken about a month ago. And now I've tested positive again for COVID. Thankfully, as you can see, I'm fairly well. I just have some mild sore throat. So the point to make here is that after taking 2 doses of the vaccine, you're actually protected from severe disease and death. Fingers crossed. Right. But that's the use of taking vaccines. So vaccines must be taken for whoever is eligible to take them. Sorry, I kept cutting you. Now you can ask me more questions.
No, I think Dr. Parikh will come in. Barkha is back. Dr. Parikh, would you like to come in?
Hi. First, just a comment. Barkha and I, we do go back and forth about lockdowns and other things, but we actually have gone back and forth about whether India was out of the woods and whether something worse lied in our future. My position has been that the worst was to come, as we're seeing now. And I think one of the critical errors we've made at multiple points is assuming that the country has done well before the pandemic was over. We've seen this pattern play out in numerous other countries. We've seen it play out with pathogens. And we lifted restrictions too fast. We got complacent collectively as a society. We didn't look around us and see what was happening in other parts of the world. And now we're here where we are too late to cry about spilt milk. But one of the other guests said that everyone was surprised. I'm sorry, sir, but not everyone was surprised. Many scientists, many epidemiologists, many virologists consistently pointed out that this was coming. Pointed out even once the numbers started to increase transmissibility. I know because I was one of them. I can tell you that I wrote a book about this last year where I explicitly laid out this is the pattern we've seen with other pathogens. We saw this happening in other countries. So when we talk about the numbers rising, what we really need to ask ourselves, why did we allow mass congregations? When we saw the impact of that in other countries, what did we think was happening? Why are people still surprised? We should have known that when susceptible hosts come together, it gives the virus a chance to spread very efficiently. That's what happened. The healthcare system has scaled as much as it could in the time with the limited resources it was given. No matter how much you scale a healthcare system, on the other side of exponential growth is a catastrophic failure of the healthcare system. Barkha, you and I have gone over this several times, and I
think we're losing Dr. Parikh also. Radhika, you seem,
we were discussing that the numbers were low then. The deaths and hospitalizations we are dealing with today are a consequence of the numbers that occurred 3 weeks ago. the numbers that we are seeing today, the number of infections that we are seeing today, the hospitalizations and deaths due to that await us in our future. We are already seeing a catastrophic failure of our health system. Every day that we allow exponential growth to go on, that's another day of horrific numbers sometime in our future.
See, again, as a layman, I'm saying this to all. The impression I get, what Barkha was talking, the coordinated strategy is seemed to be missing. Like I have heard from unconfirmed sources, Dr. Soin, that even remdesivir production was tapered down when cases went down, and therefore they're taking time now to ramp up because there is a certain batch cycle time and testing time, and so they can only step it up by May. You're talking about Modi critics. One of the strongest Modi critic tweeted in the month of Prashant Bhushan in the month of February. Why are we wasting money on vaccination? The pandemic is disappearing. We can put the money in some other socially useful causes. So everybody has an opinion, but the concerted central strategy, there must have been something, but again, I don't know how far the communication, what people fault Maharashtra about, that, okay, 2 months it was coming, what did you do? But what did also a central monitoring mechanism do to step in and in a constructive dialogue? So that is my worry today also. Is that happening, that kind of a communication gap? Yeah. Yes, Dr.
Can I just comment? Yeah, can I just comment on that? I think, to be fair to the government, ICMR and the Ministry of Health, they are putting the latest recommendations and updates of those recommendations on their websites. They're actually, even the state government health departments are communicating that to the various healthcare institutions. But, none of those are imposed. Like, nobody can tell me how I treat my patient. So if I feel that remdesivir should be used on day 2, I just go ahead and use it. If somebody else wants to use it on day 5, they can go ahead and use it, even though the recommendation is, let's say, day 5 onwards, up to day 10. So that's the slight gap there, because you cannot enforce medical guidelines. They are just guidelines. They're not a diktat. That's the slight problem. But there are
not the medical guideline, but I'm talking, doctor, in the macro management strategy at a state level or a national level. I'm not too sure whether that is really cutting across. Say, take the controversial case of Bengal today. Okay, everybody is pointing their finger as far as the election gathering, whether the election 3 phases. But what I don't see in Bengal is the strategy. Today, when the government is in limbo, there is really it's a caretaker government. Last year, one did see a strategy, even if there was dynamic tension between the center and the state, you could see the dialogue happening and something there. But today, it seems like, just anybody's game. Barkha, come in.
Thanks, Sandip, for stepping in for me. But I'm in terribly patchy network, which is the perils of traveling in the way that we do. But if you guys can hear me, Dr. Soin, what I first wanted to ask both you and Swapneil is, what is the final remdesivir? When we see people queuing up, doctors and health workers among them, would you say it's needed or not needed? Swapneil, I'll start with you.
So, I actually addressed that while you were offline.
Yeah. Barkha, that was discussed. He said till about 4 days. It's not a deal breaker, is what Dr. Soin said. And
it's not something you need to save anybody's life. It's not a life-saving drug. It just cuts down the recovery period. So if you can get it, it's good. But the mad scramble is certainly not justified.
It is for he mentioned there's the steroids and anticoagulants and oxygen. Those are the critical ones. And Swapneil was mentioning that, how people should have anticipated this coming. People like him had been talking that, it's not behind us, but people didn't take note of. And that's where I was saying today, is there a communication of strategy which is happening across the country?
I'm going to have to log out.
Okay, so I'll tell
Sorry.
you what.
Yeah.
I'm not in the best network, so I'm just going to ask everybody to make a concluding comment on what we're doing wrong, and is this situation still salvageable? Is there still a way out of this? Is there still a way for this country to come together at this moment of crisis? I'll start with the doctors very quickly, and then I'll go around the panel. So Swapneil, let me start with you. Is there still a way out? What would you advocate at this point?
There were
Swapneil,
many
can you hear
things
me?
we could have done to prevent this, but
What do we do today is the question, I think.
our failure,
Yeah.
failure to do those things means that we have very few good options now. We've boxed ourselves into a corner where we have to break the circuit of transmission. And unfortunately, there is one tool that is going to preserve our healthcare system right now, and that is a very harsh and stringent lockdown. We're going to get there regardless. As you know, Barkha, I've been advocating for steps to prevent this. But right now, this is the only tool that is going to preserve our healthcare system. And of course, we need to ensure that the least privileged members of our society don't suffer for this. We need some form of welfare or socio-economic packages to help them during these times. But across the world, we've seen when we allow the virus to spread uncontrolled, that works out to be far worse than short-term interventions to slow it down.
I think Dr. Soin has left,
Okay.
so move on to, I think,
Sure.
Shantanu. And
Yeah, Shantanu, go ahead. Shantanu, go ahead. Last words.
I think, to my understanding, these are tough times. We can wait for a love for a politician or hate for another one for another day. India has done quite well till now. If we see the death per million, we are at 130, not even the top 80, 90 countries. And we should stand with our governments and make sure the time we are spending in showing what's going wrong, also spend that time to make sure our vaccination percentage increases. We are only, even after 12 lakh crore vaccination, I think we are only at 6-7%. Once we reach 40-45%, we will reach towards herd immunity. I think let's work toward that rather than cherry picking here or there.
Radhika?
Okay, Sandip, you yourself. No, Sandip. Why don't we start with you?
But my point is very simple, Barkha. One is communication. It is absolutely essential. Number two, as everybody is saying, I see the lockdown as unavoidable. And if the lockdown comes, as we discussed earlier, there has to be a very different kind of economic intervention this time. We cannot pussyfoot. There has to be, cash subsidies, support to people. And I would expect the government to come up with that plan. And that's where I wrote today, maybe till May 2nd, they cannot announce some of these economic packages. But meanwhile, the rest of it has to be communicated and put in place.
Swapneil, are you advocating for a national lockdown or micro lockdowns?
Barkha, we have very few good options right now, and the faster we intervene, the more rigorously we intervene, the less we will suffer over the long term. Micro lockdowns don't work when you have porous borders between the containment areas. There has been no country in the world where a strategy of soft lockdowns or micro lockdowns has worked. And whenever people have tried it, it has actually led to a longer and a harsher lockdown in the future. I completely agree. We need economic packages to make sure that the most downtrodden members of our society don't suffer the most for our catastrophic failure to prevent ourselves from getting into the position where we are today.
Okay, so we'll do a separate show on the efficacy of lockdowns. I just want very quickly to get Radhika and Tavleen to wrap this up. Radhika, go ahead.
Yeah, this whole phase has been marked by too much animosity between the center and the states. So first of all, I would say that the trust deficit between the center and the states, the opposition ruled states, must go. You have to work in a spirit of consensus and not confrontation. There's no point scoring brownie points. Today when I was listening to Kejriwal, the one point he kept stressing is that, we've always been very truthful with the data, with our data, with sharing our data. This is not the time to score brownie points, for God's sake. Let the center reach out to the states, let the states cooperate with the center, and let there be some degree of cooperation and not confrontation.
Very valid.
I somehow feel that we're kind of beyond that point of still finding some political reconciliation. Tavleen, wrap this up for us.
Okay, I don't think it's about politics. I think it's about an absence of a strategy. I want to know by when the government plans to vaccinate half the population, which is what we need for herd immunity. I want to know why we only ordered 11 million doses of vaccination when America was ordering twice the number that it needed for its population. So basically, I'm not in favor of lockdowns. I think that you have to have a strategy. The Prime Minister has to make clear what the strategy is, who is in charge, and who is the spokesman for that strategy, and when can we expect for India to have half the population of this country vaccinated. That's our only tool against this disease.
I have to say I agree with that, and I will continue to argue that there are people behind the numbers. Those people need to have their voices heard. There is a journalist, heartbreaking story of a journalist in Lucknow who died asking for oxygen on Twitter. There are these stories everywhere. To go out and find them. I apologize to our audience for a little bit of a patchy network today. It happens sometimes when we step out into the interiors and try to go to where the story is. Thank you for your patience and for sticking through with us, and for Sandip for stepping in and into my role. So thank you. But we will continue to bring you stories from the ground, from across India. That much we'll promise you. The medical dimension, the politics, the absence of communication, and the tough questions that must be asked of all parties, the centre and the multiple states. Radhika, Tavleen, Shantanu, Dr. Swapneil, Sandip and Dr. Soin, thank you. And to our audience, see you tomorrow. And there are many more ground reports that you can check out on our platform, from medicine to the human tragedies. We're covering it all. Thank you for watching and see you soon.